We're very excited about the DARZALEX data being presented here at ASCO. The CASTA results are the first phase 3 results from the Daratumumab clinical program. It's looking at Daratumumab in combination with Velcade-Dex versus Velcade-Dex. And Velcade-Dex is really a standard of care in the relapsed and refractory setting. This is the first phase 3 data. It's here in the official press program, but it's also at the late breaker session. And it really just shows some compelling results in terms of how Daratumumab in combination with Velcade-Dex has really significantly improved progression-free survival. And when you look at the hazard ratio, it's something that we've not seen before, with a hazard ratio of 0.39, highly statistically significant. That hazard ratio represents more than a 61% reduction in the risk of progression or death, but when you boil it down, it really means that you have improved the progression-free survival by more than 100%, which is fantastic. Median progression-free survival hasn't been reached on the Daratumumab arm, but was reached on the Velcade-Dex of around about 7.2 months. When we look at response rate, we also see really terrific response rate data, 83% versus 63%. But what we also see is we see a doubling of the VGPR rate and a doubling of the CR rate as well. And you'll see in the late breaker session later today that will also show really strong MRD data as well, more than doubling the MRD rate. So Daratumumab, I think, is really providing a lot of excitement to really kind of moving the field forward. Daratumumab in many ways is the rituximab of myeloma. It's that monoclonal antibody that we've always wanted. Daratumumab is the first CD38 that's been approved. It's the first monoclonal antibody that's been approved for multiple myeloma. And with that, you see this direct on-target effects in terms of myeloma. Has great single-agent efficacy, but we're also learning that it also has immunomodulatory properties as well, by directly targeting stimulating parts of the immune system as well, like myeloid-derived suppressor cells, but it's also having T-cell effects. From a tolerability perspective, they were equally balanced in terms of discontinues for tolerability. Overall, the safety profile was very good, and it was consistent with what we've seen before with either Daratumumab by itself or Velcade-Dexamethasone as well. So extremely compelling results, significant improvement in progression-free survival, doubling of that PFS, doubling of the VGPR, doubling of the CR rate. I think it's really going to bring patients a great new option in that relapsed refractory setting.